السلام عليكم ورحمة الله وبركاته. طلاب الأعزاء، محاضرتنا اليوم تغطية سريعة لعلاج سرطان الرئة Pharmacological treatment of lung cancer. So first, just a brief definition of the cancer. As you know, cancer refers to the uncontrolled growth of abnormal cells that start off in one or both lung, usually in cells that line the air passages. The abnormal cell usually doesn't develop into healthy lung tissue. However, they divide rapidly to form a tumor or cancer. How tumor cancer, lung cancer can be classified? It is generally classified or subclassified to two types. Non-small cell carcinoma, which accounts for about 80% of lung malignancies. These type of tumors are less often metastatic. They are less responsive to chemotherapy, curable by surgery if they are limited only to the lung. As you can see in this figure, so there are three types: squamous cell carcinoma, and adenocarcinoma, and large cell carcinoma. And the second type, which accounts for about 20%, it's called small cell carcinoma. So this account or constitute about 20% of lung malignancies. It is usually metastatic and responds to radiation and chemotherapy. In this slide, just I summarized how lung cancer can be treated. So it can be treated by surgery, limited to the lung, radiotherapy, chemotherapy or target therapy targeting the molecular pathway, and palliative therapy just to help the patient by reducing his pain and just assist him to live as much as he can, live happily, support him spiritually when needed. In this slide, this slide shows you the classification of anti-cancer drugs. I do believe you already have this slide earlier, but however, just I want to highlight that we're going to talk about taxanes group here. We need to know about it. We're going to talk about vinyl alkaloids and platinum analogs, carboplatin and others. We need to know also there might be a need for drug combination. Even with cancer treatment, but why? First, to provide maximal cell killing within the range of tolerated toxicity, and combination therapy usually effective against broad range of cell line, although it's heterogeneous tumor population, and combination therapy also prevent or delay resistance to cell lines. As many medication, anti-cancer have side effects. The general side effects will be severe vomiting, stomatitis, bone marrow suppression, alopecia, which is like normal response, and so on. This is in general. However, we have specific or confined drug reaction to each drugs. And we have not to forget that anti-cancer drug, they have narrow therapeutic index. What does that mean? Like slight modification or increase or decrease in dose might have serious side effects and could be life-threatening. So now this is a brief overview about non-small cell carcinoma. The first group of drugs will be platinum-based chemotherapy. Member of this group includes cisplatin, carboplatin, vinorelbine, vinblastine. They are mostly effective for treatment of non-small carcinoma. What are platinum analogs? They are general alkylating agents. They inhibit the DNA synthesis and its function through binding to DNA by formation intrastrand and interstrand crosslink. With using these group, adjustments required in case with renal disease or renal dysfunction, because excreted mostly in the urine. Belong to this group, we have cisplatin, carboplatin, which seem to be less nephrotoxic, which is a favor of advantage. We also have oxyleptin. So this drug, it can be used if resistant developed to either cisplatin or carboplatin. So what we mean by resistant? So resistant failure to response to the given drug at the same dose. But why? It's for many reasons. This resistance could be primary, for example, like absence of response on the first exposure. Sometimes could be acquired, and it's linked sometimes with what we call multi-drug resistant gene. So it's happened or resistant occur against more than one drug. Resistant is not only with anti-cancer, it's very common with antifungal, as we discussed, with antibiotic, which is a problematic. So the second group is vinca alkaloids. They are derived from plants. They are a group of indole-indoline dimers. They are extracted from vinca plants. They exert their mechanism of action by inhibit the tubulin polymerization, resulting in mitotic arrest in metaphase and cell dying. They are metabolized mainly in liver, emulated in bile and feces. So, since they are metabolized in liver or through the hepatic system, so the dose adjustment should be maintained in patient with impaired hepatic or dysfunction or with patients who have pulmonary obstructions. Belong to this group, we have vincristine, vinblastine, vinorelbine, and vindicium. The third group of drugs here we're going to talk about are paclitaxel and docetaxel. These two drugs belong to taxane family of cytotoxic. These drugs promote polymerization and stabilization. The third group of drugs here we're going to talk about are paclitaxel and docetaxel. These two drugs belong to taxane family of cytotoxic. These drugs promote polymerization and stabilization of microtubules, then do the disassembly. By doing this, they lead to formation of stable microtubules, which are non-functional, resulting in inactive or inert chromosome. As a result of all this, it will cause cell death. These drugs undergoes hepatic metabolism, excreted through bile or biliary system. Again, since they are metabolized through hepatic system, so dose adjustments are required in patients with hepatic dysfunction. The most common observed reaction is hypersensitivity. We also have pimetrexid. So pimetrexid is similar in its mechanism of action to methotrexate. So what it does, it inhibits dihydrofolate reductase synthesis. However, these drugs also inhibit thymidylate synthase, leading to cell death. Gemcitabine. This drug is an analog of nucleoside deoxycytidine. It's mostly used for pancreatic cancer and non-small lung cancer. What about the treatment of advanced non-squamous cell lung carcinoma? We can use cisplastine and pimetrexid or cisplastine and gemcitabine. This is all about chemotherapy. In our introductory slide, we mentioned that we have targeted therapy. So the target therapy of lung cancer, or generally, refer to the agent that's specifically designed to target or inhibit molecular pathways that is responsible to specific malignancy phenotypes. Belong to this group, we have either a drug that targets tumor blood cell growth or angiogenesis. As we know, tumor need to grow. That's why they need to form new blood vessels to keep them nourished and supple. This process, as you know, it's called angiogenesis. Drugs that inhibit angiogenesis are called angiogenesis inhibitors. What they do, they will block these new blood vessels from growth, so preventing that nutrition and supply from the cancer, leading to their death. We have bevacizumab, which is a monoclonal antibody that targets vesicular endothelial growth factor. And we have ramucirumab. So two agents belong to this group. We also have drugs that target cells with epidermal growth factor receptor. So epidermal growth factor receptors is a protein found on the surface of the cell. Normally help the cell to grow and divide. In cancer cells or tumor cells here, what we have too much from these receptors. That's why making them grow faster and multiplicate. So just imagine if we block or stopped these inhibitors, these receptors from multiplication or growth, so in that case, the cell will dead. Because this group into epidermal growth factor receptor inhibitors, they cut or block the signal from the epidermal growth factor receptor, which is known to tell the cell to grow. Blocking it, there is no more growth. These agents are used in non-squamous cell lung carcinoma, specifically that possess mutation or have a mutation. Belong to this group, we have two drugs. They are presentable by tyrosine kinase inhibitors, erlotinib and giftinib. Both drugs have significant and clinical importance, and they are very effective compared to standard chemotherapy. They are used as a first-line treatment in patients with disseminated non-squamous cell lung carcinoma, specifically those patients with activating mutation to the epidermal growth factor receptor gene. With this slide, we have reached the end of our lecture, which shows treatment of small cell carcinoma. So for limited stage, we have to use concurrent chemotherapy and radiation therapy, which appear to be more effective, and in more extensive stages, as we mentioned, so chemotherapy is the treatment of choice. Cisplatin, etoposide, cisplatin, anostan, and others. Thank you so much, and please reach out to me. I'll be with you on Telegram, answering your question, and I can talk in more details with you. Thank you so much.